this video, I'm going to demonstrate how to assess vitals and how to conduct a general survey. These procedures are often used by physicians, nurses, and other healthcare professions when examining a patient. First, you welcome the patient. Introduce yourself and ask the patient to assume a sitting position. Okay. Hello, my name is Dr. Beth, and I will be assessing your vitals today. Take a seat, and we'll get started. So prior to measuring the vitals, the patient should have approximately 5 minutes to rest and relax. During this time, you can conduct a general survey. Can I please see your hand? I'm just going to be testing your blood circulation. Okay. Now I want you to touch your nose with one hand and then switch. So, as you can see, I just did a few general survey activities. Basically, a general survey is a visual observation of a patient, so you can observe things like level of consciousness, mood, personal hygiene, skin color, posture, and mobility and range of motion. So the ones that I just demonstrated, one was a circulation check to see if the patient's circulation is good by pressing on their fingertips, and if it returns to color in a short amount of time, then their circulation is good. Also, just by looking at the patient, you can look at their skin color and skin tone to see if it has a pinkish tone, and that means it's healthy. You can do other things such as the whisper test to see if their hearing is alright. You can also do the finger to the nose test to see if mentally they're able to do it. So after you completed your general survey, you're ready to take vitals. So today I'll be assessing your vitals. Do you have any questions before we start? Okay. So always make sure you describe the processes to the patient and make sure to tell them the information that you are going to do. So first I'll be taking your heart rate. I'll just need you to roll up your sleeves, which are already done. I'm going to put my fingers on your radial artery and count how many beats there are in 10 seconds. So I got 10 beats in 10 seconds, and you always want to multiply that number by 6, and then you'll get beats per minute, and the average beats per minute is 60 to 80 beats per minute, and you had 60 beats per minute. So the second test I'll be doing is a breathing rate. Once again, I'm just going to ask you to normal breathe, inhale, and exhale, and I'm just going to count for 10 seconds. Okay, so your breathing rate is approximately 3 beats per 10 seconds. So, and the average breathing rate is 12 to 20 per minute. So you have a very normal breathing rate. So the third vital sign I'm going to be testing is your temperature. When taking a patient's temperature, there are 3 ways you can do it. Through the ear, the mouth, and under the armpit. And the normal temperature is about 36 to 38 degrees Celsius. Oh my goodness, it's such a perfect temperature, 37 degrees. Okay, and the last vital sign I'm going to be taking is blood pressure. First you want to find the pulse. Once you find the pulse, place the cuff just above it.
Hi, I'm Dr. Tanner, and is it right here?
Yeah, okay. So you want to make sure to place this. Oh, never mind. Okay. So after you place your cuff on, you want to put the stethoscope on and place it on the pulse.
I'm Dr. Tanner, and hi, I'm Dr. Tanner.
Okay. Once you've found the pulse, you're going to inflate the cuff to approximately 200.
Very quick, nothing hard. Then you can write the patient
Okay, so then once it gets to 200, you're slowly going to deflate it, and you're going to listen for the first sound, which will show you the systolic pressure, and then when you hear it start to slowly slow down and then eventually stop, is the diastolic pressure.
Did you fall? Did you
Okay,
So
so
Samantha, I'm just going to do, after the patient gives more information, you can then proceed to take, you can just like to take the patient.
the average blood pressure is 120 over 80, and so you have very normal blood pressure. So now you're complete with taking vital signs. You want to thank the patient and wish them. I don't know. Okay, nice seeing you.
Also,
Hey, we're done.
such as any allergies, dietary restrictions, medications and dosages, and also
So the next one we're doing is conducting a patient interview. So when conducting a patient interview, it is important to make the patient feel comfortable. So during the interview, they will feel comfortable to share any information that could be necessary to
personal information.
Just keep going. Okay.
Sorry, no, I just think I'm going first. Do you want to just like do it in two parts, or do you want to just cross?
Just keep going. Yeah.
This video is going to demonstrate how to conduct a patient interview. This type of interview is used when a patient comes into hospital emergency room with general symptoms that are not diagnosed, and general information that is needed to help you figure out what you're doing.
So first, I'll start.
So when conducting a patient interview, it is important to ensure that the patient feels comfortable. So during the interview, they will feel comfortable sharing any information that to be necessary during the interview. To start, introduce yourself and explain to the patient what type of testing you do.
Gender.
Hi there, I'm Dr.
Hi.
Hello.
And your weight.
Okay, so today we'll be doing a heart rate, a breathing rate, a blood pressure, and temperature test. Next, ask the patient what property to hospital. So what's property city?
Recently I've been having really bad headaches and also really bad stomach pain.
Skip all that, blah, blah, blah.
All questions should be asked politely and professionally to gain more information. At this time, you should fill out the new information form. In this form, you will be asking for general information such as their name, birth date, age, gender, height and weight, address, phone numbers, emergency contact, and their family. Okay, so can I get your name? And what day were you born on? And your age?
17.
Sorry.
12.
And do you represent as female?
Yes.
Okay, and your age?
5 to 11.
Okay, and your weight?
Under 12 pounds.
And are you married? And what's your home address?
509 2
Okay, and what city do you live in?
12.
Ontario. And what's your postal code?
And my C just 5 T.
Okay, can I grab your home phone number?
509 1
Okay, and do you have a cell phone number?
No, I don't. Sorry.
Okay, and who would your emergency contact be?
Probably my mother.
And her name is?
Okay, so I'm just gonna like run.
And her phone number?
Just gonna run slides.
111.
Example.
Okay, so, and who's your family doctor? And do you have the phone number?
Doctor,
No, sorry, no, but I can give that to you.
Okay. The next question is to ask if the patient has any known allergies or dietary restrictions. So, do you have any allergies that you currently have?
I'm just allergic to gluten.
Okay, so I'll just.
Okay, any dietary restrictions other than Next, ask what types of medication, either legal or illegal, that they have ever taken in the past or any they are presently taking. So, are you taking any current medications?
Currently,
So
no.
that can.
Okay. Any dosages of any kind? Are you doing drugs at all, or
No.
do you take anything for the gluten allergy?
I used to. I'm not sure what it's called, but I've stopped that probably 3 years ago.
Okay. And have you? So that was just one medication. Do you have any other kind of medications that you've ever taken?
I think that's it.
Finally, ask the patient to tell you about any of their present symptoms that they may have. So you said you've been having stomach pains and headaches.
Yes.
Okay. Are there any other symptoms that you've been having? And can you remember when these pains started?
Probably about a month ago.
Okay. Have you ever had any pains like these before?
When I first found out about my gluten allergy, yes, but not since then.
Okay. And you stopped taking your So the last step is in the patient interview is to give the patient a checklist and be ready to answer any questions that they may have. This checklist can help you find out any additional info you may have missed. So can you just fill out that checklist for me? So now you have successfully conducted a patient intake interview.
Okay, we're done.
Yeah.